So this is very exciting. We're going to dive into the factors that lead to autoimmunity. And we're going to look at these factors from different angles. And I'm going to show you some really interesting studies that came out, shed more light on how these impact our immune system. So obviously we have the genetic predisposition. We have the dietary component, toxic chemicals, gut microbiome, and infections. Now we have more than that, but this is a summary. And if you only remember to work with your patients on a few factors, then if you only have time for 3 factors with your patient, I would always look at the gut. I would always look at toxic accumulation or environmental exposure. And I would always look at their diet. Those are the 3 most important factors that in many patients are leading to chronic inflammation and autoimmune conditions. Now, environmental factors, and we're going to talk a little bit about BPA, Bisphenol A, were reported to disrupt the action of thyroid hormone. BPA is an organic synthetic compound that firstly synthesized in 1891 to produce clear, hard resin that is widely used in the packaging in food and drinks, safety and medical devices, thermal paper, and dental components. BPA has a short half-life. So it's basically, it could remain in the air for 1 day where we can breathe it in. It could remain about 4.5 days in water and soil when we can drink it. But it could accumulate in human tissues and organs. There are some interesting reports showing that it actually could accumulate in our tissues. The structure of BPA and its analogs resemble that of T3 and can bind to thyroid hormone receptors, basically acting as antagonists to the thyroid hormones. So you can see here in marked from left to right, A is T3, B is bisphenol A, C is bisphenol F, and D is bisphenol S. These studies suggest that these environmental factors interfere with the thyroid hormone synthesis, transport, and metabolism. When we talk about BPA and inflammation, there are 2 cross-sectional studies that also revealed that BPA exposure was linked with inflammation and oxidative stress in men and postmenopausal women. BPA changes the function of the immune system. It increases inflammatory activities by stimulating production of pro-inflammatory cytokines such as tumor necrosis factor alpha and interleukin-6, which are well-known cytokines for causing inflammation, and they're associated with ongoing damage. For example, there are studies that reported very high levels of interleukin-6 involved in peripheral neuropathy and damage to those nerves, and as well as damage to the joints during arthritis or osteoarthritis. BPA also acts as an inhibitor for the production of anti-inflammatory cytokines. So not all inflammatory cytokines are bad, as we all know. Some of them, like interleukin-10, are great for buffering or regulating the immune system and have a really good anti-inflammatory impact. Higher BPA levels were associated with higher BMI, blood pressure, and plasma CRP levels. So BPA overall, what it does, it increases the pro-inflammatory cytokines, reduces the anti-inflammatory cytokines, and damages our metabolism or interferes with our metabolism, which is just a perfect recipe for more metabolic issues, cardiovascular issues, and down the road to develop autoimmune conditions. BPA also leads to mitochondrial dysfunction, downregulation of antioxidant enzymes, and alternation of cellular signaling, which increases the production of reactive oxygen species. Now, in this interesting graph, we can see sources of exposure to BPA. That includes ingestion, inhalation, through the skin, through creams and lotions, eye contact. And once it's in the human body, BPA can negatively impact several targets, such as the thyroid, adipose tissue, liver, heart, female and male reproductive organs. So this is really important because a lot of our patients, for example, use lotions, and some of those lotions are stored in plastic bottles. And some agents, for example, like essential oils, could facilitate the release of those different chemicals from the bottle packaging into the lotions. Same thing when you leave a bottle of water out in the sun, or you warm up your food in a plastic container. That accelerates the leakage of those chemicals into your food, and you consume it. So BPA can directly or indirectly released into the environment at any level of the life cycle of the product. That means the production, consumption, and even disposal. BPA is colorless and can be released by plastic products, as we mentioned, as the results of heating, acid or basic conditions, as well as the presence of high levels of sodium chloride or vegetable oils. BPA is absorbed through the skin. For example, thermal papers can release the BPA through contact with the epidermis. And BPA can also cross the placental barrier and has been detected in human maternal and fetal serum and human placenta. So think about, for example, the cashiers who are handing over the receipts all day long, right? That's an ongoing exposure to BPA. Think about patients who are drinking water from a plastic bottle. That could be an ongoing exposure as well. Or patients who are storing their food in plastic containers or warming them up at work in a microwave. That could be an ongoing exposure, which would be very beneficial for us to educate them into replacing their containers with glass, ceramic. And there's some really affordable stuff out there. We replaced all our plastic storage containers with IKEA glass containers, and they were like 3 or 4 jars for like $14, right? It wasn't very expensive, but you can buy a nice set for like $20, $30. You can buy 2 or 3 sets of those glass containers and just start storing water in glass bottles and all of that. BPA is considered an endocrine disrupting as chemical, as we mentioned. BPA acts like estradiol, stimulating different cell responses, although its affinity for estrogen receptor is lower when compared to natural hormone 17-beta estradiol. So just to remember, if you're seeing patients with hormonal imbalance, BPA is an endocrine disruptor, which we have to address it. It's not enough to look at the gut. It's not enough to just look at their diet, and it's not enough just to look at doing a hormone replacement therapy if we cannot address the underlying cause of the hormonal disruption. And one more thing is a lot of patients buy foods in cans, and I find myself doing the same thing sometimes. And so I'll always prefer to get frozen food if I can, rather than canned food. And if I cannot find a better alternative that is frozen, and I will try to get a product that has no BPA in the lining. And typically there's like a little logo on the can saying no BPA. Okay, these are the resources.